Welcome back. The U.S. Embassy, in partnership with the Ministry of Health and Social Services, has launched the Undetectable Untransmittable campaign together with the HIV risk hotspot mapping and key population size estimation report. The campaign and the findings study will help Namibia tackle challenges pertaining to key population groups that are at an elevated, risk of contracting HIV. Now, for an in-depth discussion on this, I'm joined by the Chief of Party KP Star Project, Isabel Mendes-Siyamba from IntraHealth Namibia. Good evening, ma'am, and welcome to the show.
Good evening, and thank you for having me.
All right. As mentioned earlier, the findings are aimed at helping Namibia in achieving a more targeted approach. Firstly, which population groups are more at risk of contracting HIV? And added to that, how were these groups identified?
The population that are at most risk for contracting HIV, under the population program, we have female sex workers, transgender individuals, and MSM, that we call men having sex with men. And four.
All right. Now, what are some of the notable findings in the report that you can share with us?
The report is in three thematic areas, on access to HIV services, violence, and also on stigma. On access to HIV services, only 15% of the hotspot had received or had access to full range of HIV prevention services, such as condoms, lubricant, HIV testing. Violence was reported to have occurred or experienced at 59% of the hotspots, and we've also had 22.5% of key population that have reported to have been mistreated by healthcare workers across the 9 PGAs where the study was conducted.
All right. Now, which regions were identified as hotspots in the country and thus far, and what have been the driving forces that drove this surge?
We wanted to find out or to define and also identify the hotspot areas within the geographical areas to enable us to do better targeting, better targeted intervention, and also provide health services at this hotspot to bring services closer to the key population or to the population that we serve.
All right. Now, Ms. Mendez, what are some of the remedies that have been aligned in reducing the spread of the pandemic in these areas?
We have increased access and demand for HIV prevention services, treatment, and care. We've also scaled up HIV self-testing, including scaling up of pre-exposure prophylaxis. And also we have actually strengthened case management to ensure that those who have tested HIV negative remain negative, and those who tested HIV positive are enrolled in case management to ensure treatment adherence in order to increase the number of people that are virally suppressed.
All right. Talk to us about the Undetectable Untransmittable campaign. How does it help reduce stigma and discrimination of the people living with HIV?
One key aspect is not to transmit HIV, and also one of the benefits of that is viral suppression and also getting back to normal. Once people know their status and they are not, they are aware that once they are undetectable equals untransmittable, they are more likely to not to transmit the virus and transmit new HIV infection, because they are more comfortable and they are also more free. And the general population as well will not have really to worry about those that are living with HIV.
All right. Now, what are some of the recommendations that were considered in the report, and how will they be implemented?
One of the recommendations was to scale up HIV services at hotspot. So what we are doing is to provide health services during the day and also during nighttime, that we call moonlights, because the hotspot results indicated the time frame which the hotspot are busy. So we are actually mixing our intervention to ensure that we provide access to services, whether be it nighttime or during the day. and also to scale up our condom programming, especially in areas such as Chicago, where it was determined that the condoms were not that sufficient. So those are some of the interventions that we are doing, or that we have actually started doing.
All right. Ms. Mendes, thank you so much for joining us this evening.
It's a pleasure. Thank you.
That was Ms. Isabel Mendes-Siyamba from the IntraHealth Namibia, the chief of Party KP Star Project, talking to us about the Undetectable Untransmittable campaign that was launched today by the Ministry of Health and Social Services. Don't go anywhere.